Hello everyone, welcome to the second episode of Movement Disorder Society of India author podcast series. Here we are interviewing the lead authors of recent interesting as well as landmark research papers coming up from India. I am Dr. Mitesh Chandarana, a movement disorder specialist at Medisquare Super Speciality Hospital, Ahmedabad. And today we have a new guest with us, Dr. Niraj Kumar. Dr. Niraj Kumar is a movement disorder specialist as well as additional professor and head of Department of Neurology at All India Institute of Medical Science, Rishikesh. And today we will be conversing with him about his recent research paper published in Sleep Medicine Journal entitled Impact of Home Confinement During COVID-19 Pandemic on Sleep Parameters in Parkinson's Disease. So it is a multi-center cross-sectional study of around 850 patients of Parkinson's disease enrolled from 9 different movement disorder centers across India using an online survey questionnaire. The study showed that about 1/3 of patients that were enrolled reported sleep disturbances, and nearly 1/4 of enrolled patients reported either new onset or worsening of existing sleep-related symptoms. So let us get into the details of this study with Dr. Niraj. So Dr. Niraj, a very warm welcome to you in this today's MDSI podcast, and thank you so much for joining with me here.
Thank you, Dr. Mitesh. At the outset, I would like to thank the Movement Disorder Society of India for giving me this opportunity to present a few facts about my paper, and I would like to thank you for taking all the pains to interview me. Thank you.
Right. So, how did the idea or rationale of studying the impact of home confinement on sleep disturbances in PD come up during such difficult times?
Thank you for that question, Dr. Mitesh. In fact, when the COVID pandemic started, somewhere around the first half of the last year, that is around March of 2020. So during that time, there was a big rearrangement sort of thing which was done in the medical care, and the entire medical care was diverted towards management of COVID-19 related cases, and which was rightly done so. In fact, there are articles which has shown that patients with non-COVID neurological emergencies also suffered during those times. And one of the other sufferers, or the silent sufferers, I would like to say, were the patients who were suffering from chronic disorders like Parkinson's disease. And in fact, a nice study done early on in the pandemic from the group of Dr. Paul clearly showed that there was a perception of worsening of symptoms in patients with Parkinson's disease reported in around 10% of the patients. So we also did a multi-center study here before the one which we are discussing right now, and that was for analyzing the sleep in patients, sleep in general population. And we found that almost a quarter of the 950 respondents, they had some sleep issues. So I had this idea in my mind that we should try to study the sleep in our patients with Parkinson's disease. And I was repeatedly receiving calls from them regarding the worsening of symptoms, and few of them were having worsening of sleep also. So I floated this idea, and I was supported and motivated by all my colleagues and my seniors and my colleagues, including Professor Vinay Goyal from Medanta, Dr. Rishikesh Kumar from Institute of Neurosciences, Kolkata, Dr. Rupa Rajan from AIIMS Delhi, Dr. Sahil Mehta from PGI Chandigarh, and Dr. Soham Desai from Sri Krishna Medical College, Anand, and then Dr. Vadia, Petrusov Vadia from Jaslok, and Dr. Rukmini from Nizam's Institute of Medical Sciences, and Dr. Prashant from Vikram Hospital, Bangalore. So I think probably all of us came together, and they significantly supported my idea, and that is how this study, or the seed of the study, was sown and it started.
That's great. That's great. So, Dr. Neeraj, what were the major inclusion and exclusion criteria of patients enrolled in the study?
As as we discussed, so the major inclusion criteria was to try to involve as many patients, or try to interview as many patients who were diagnosed with Parkinson's disease and were being followed at these 9 movement disorders center, and as much as possible. So this was the inclusion criteria, and then we did exclude patients who were pregnant, and patients who were suffering from COVID-19 infection, or who were quarantined. Then we also excluded patients who were involved in uh, uh, emergency occupations, or occupations where they were required to work in shifts, like police personnel, or medical workers, or healthcare workers. And we did exclude patients who were significantly cognitively impaired, and we didn't have their caregivers to answer their questionnaire.
Okay, okay. So moving on to the next question. As I mentioned earlier, an online survey questionnaire was used and shared with the patients. So tell us something about that questionnaire, and how did you develop it and validate?
So in fact, that was the second uh, most important part after the inception or the thought of the study. So that included formulating a questionnaire, and that questionnaire we aimed to include most of the most of the facts, as well as the factors which would have influenced the clinical situations of our patients during the home confinement. So it was divided into 6 subsections, apart from the consent subsection, and it had a subsection on socio-demographic profile of the patient. Then it had a subsection on the Parkinson disease duration and other comorbidities, and then it had a subsection on motor and non-motor symptoms, and a separate subsection on sleep related problems being faced by our patients. And then it has subsections on the status of formal neurological consultations and difficulties being faced by our patients in getting those consultations, along with any difficulties they were facing in getting the Parkinson's disease medications. And then we had a subsection on the physical activity, or the duration of physical activity and screen time, along with the social interactions and quality of life in our quality of life in these patients, or I would say respondents. So the clinical subsection, including motor and non-motor symptoms, and the sleep subsection. So we had asked our patients about different problems they were facing, or and in in those parameters, the motor, non-motor, and a separate section on the sleep. And then we had asked them whether those symptoms were whether they had those symptoms ever, and if they had those symptoms, whether they showed any signs of improvement, or any signs of worsening, or any signs of, or any new onset symptoms during the home confinement or the preceding 2 months. So this questionnaire, after it was built, we got it validated by our experts, that is all of our co-investigators from the different movement disorder centers who were involved in this study. Since it was a cross-sectional survey, it involved a face and content validation. And after it was being done, we started distributing it after getting ethical approval from all the concerned ethical committees of our multi-center trial.
That's
Sorry,
great.
multi-center study. Yeah.
Yeah, that's great. So the study results show that approximately 35% of enrolled patients reported sleep disturbances, and nearly 24 to 25% of enrolled patients reported either new onset or worsening of existing sleep-related symptoms. So amongst these patients, were there any differences in the percentage of worsening in individual sleep-related symptoms such as insomnia, RBD, RLS, or sleep-related breathing disorders?
Yes. So as I said, that almost like 35% of our patients, they had sleep related issues. So of these patients, around 295 of our patients of the total 832 who were analyzed, they showed sleep related problems. So of these 295 patients, around 51% of them, they had either new onset or worsening in their insomnia. Then almost one fourth of patients each, they had either REM behavior disorder uh, or restless leg syndrome like features, which were new onset or they worsened during the home confinement. And nearly 16% of patients had either new onset or worsening of sleep disordered breathing during home confinement.
Right, right. Can you tell us about the factors that were significantly associated with new onset or worsening of existing sleep-related symptoms?
Yes, we did go on to analyze those factors, and we found that patients who had Parkinson's disease of longer duration in our study, more than 7 years, they were more prone to have this new onset or worsening of sleep-related problems. Then the patients who had home confined or who were confined to their home for more than 60 days, and then patients who had an inadequate family support when they were confined to their homes, and those patients who were physically not able to who were not able to really carry on with their physical exercises, and who had increased screen time of more than 3 hours per day, and as well as those patients who had worsening of other motor and non-motor symptoms. These group of patients, they showed or they had a significantly associated worsening in their sleep parameters. On the contrary, those patients who adapted to newer hobbies or exercises while they were confined to their homes, and those patients who carried on with their physical exercises or physical routine activities which they were doing before home confinement, they did quite well on the front of these sleep parameters.
Great, great. So, what was the impact on other non-motor as well as motor symptoms of PD amongst these patients who had either new onset or worsening of existing sleep-related symptoms? And what can be reasons for that?
So, for those, this is an interesting question, and we found that patients who had sleep disturbances or who had new onset or worsening of sleep related problems, they showed global worsening in almost in most of their motor and other non-motor symptoms. And we thought that probably there are few factors which may be maybe the reason behind this, and one of them, we thought that probably the overlap between the neurocircuitry of sleep wake cycle and Parkinson disease might be playing a role here. As we know that dopaminergic neurons or neuronal circuits are important for the sleep wake cycling Parkinson disease, with the most prominent one being those located in the ventral tegmental area and the substantia nigra pars compacta. So that was one of the things which we thought probably is the link between the sleep worsening and the non-motor and non-motor worsening. Then we thought that probably the second reason can be that lymphatics, which we have read quite, which have been coming recently in a big way in sleep and disorders related with sleep. So lymphatics basically are the paravascular channels which try to remove the waste materials or the neurotoxins from the brain, and these toxins or waste materials usually get accumulated during the daytime when our neurons are quite active, and in the night when we sleep, then these lymphatics, they remove these waste materials, and that is how it is thought that probably sleep acts as that sleep has its restorative function. Then these are the major factors which we thought probably maybe playing role in the worsening of the motor and non-motor symptoms in patients who already have sleep disturbances. In addition, in these patients which have sleep disturbances, they are more prone for cognitive distortions, and then they have an increased perception of disability. So, in these patients of Parkinson disease who have a disturbed sleep, they feel that they are more disabled and than those who have a normal sleep. So this is something which probably has been discussed in previous studies or and trials also, and this probably we thought maybe one of the reasons why those of our patients who had disturbed sleep may be reporting a worsening in their motor and non-motor and other non-motor symptoms. Yes.
That's wonderful. Uh, Another thing that our listeners might be interested into is what was the impact of home confinement on quality of life of this enrolled PD patients, and what were the factors associated with it?
When our patients had almost a significant worsening in their motor and non-motor symptoms, along with significant sleep disturbances. I mean, more than half of our patients reported a poor quality of life. And in fact, when we compared patients with sleep disturbances and those without sleep disturbance, there was a significant worsening in their quality of life in the patients who had sleep disturbances. And we did go on and inquire uh, about the reasons behind the quality of life uh, affection, and almost 40% of our patients reported that the worsening in motor and non-motor symptoms, including sleep, was the major factor they thought affecting their quality of life. And nearly 20% reported that fear of COVID-19 infection probably was the was the second major reason for them. So, and apart from that, there were other factors also which our patients thought, and they were like some social factors and the inability to uh, get formal neurologic consultation and or Parkinson's disease medications. So these were the factors which probably our patients came up with when we asked that why do they feel that their quality of life is suffering.
Yeah, right, right. Another interesting fact I noticed is that there were some patients who were on neuropsychiatric medications beforehand for PD-related neuropsychological symptoms. So, to what extent did it affect your study results?
So it is an interesting observation which we did try to bring up, and I and we found that it was only 5.7% of our patients who were on psychotropic medications, with most of them taking antidepressants, and most and all of these patients, they were on the psychotropic medications before they were confined to their homes, and it was and the medications was mainly given for their non-motor neuropsychiatric symptoms pertaining to the Parkinson disease. Unfortunately, the number was quite small, and we didn't go on and systematically analyze this. Of course, we believe that it would have affected their sleep, but then because of the low proportion of these patients, I mean, we didn't further analyze this subgroup. Yeah.
All right, all right. So my final question is that based on your study, what should be the focuses of research in future relating to sleep disturbances in PD, particularly in this era of COVID-19?
So I think this is a very good question, which probably takes us to the fact that in situations where again we may have to face home confinement or lockdown, which probably again seems to be knocking at our door. I think probably one of the things which we may like to study is the effect of this psychotropic or substances our patients are which our patients are exposed to, and how they affect their sleep, provided we have a good proportion to study. Then the other group which probably was interesting was those patients who reported some difficulty in getting formal neurological complications, as well as getting medications for the Parkinson's disease. And we didn't find that these factors significantly affected their sleep or other motor and non-motor symptoms. But then probably this we can further go and systematically analyze in future studies to see if there was any role being played by the mild or moderate or any severity of their clinical status, or if they were getting some benefit from consultations being made with the local physicians. So this was something which was pertaining to the situation of the home confinement or lockdown. In addition, I think we had again shown there's a significant correlation or significant association, in fact, between our patients with sleep worsening and other motor and non-motor worsening. So this again highlights the possibility that probably targeting sleep, and in particular targeting the glymphatic system by using some sleep enhancing agents which may improve the lymphatics, may act as a mm, uh, as a drug which, or as a tool which may be a neuroprotective, or it may slow down the progression of Parkinson disease. So I think probably this is something which is worth looking at in the future research.
And that's great. April 11 is World Parkinson's Day, and MDSI will be conducting public awareness campaign on Parkinson's disease on this day, so do watch out for this. So the MDSI will be organizing the virtual conference on 15th and 16th May, coming up soon. Watch this for more details and announcements. So Dr. Niraj, thank you for joining with us in today's MDSI podcast. We congratulate you for your inspiring and thoughtful work, though there is no need to say because your work speaks for itself. So this is me, Dr. Mitesh from MDSI. That's it from the second episode of MDSI podcast series. Thank you for tuning in. We will be back very soon with our third episode. Stay tuned. Thank you.
Thank you, Mitesh. Thank you, MDSI.